Hi, and welcome to the MedTech Insider, your inside look to all things med device. My name is Parker Snedden, and I will be your host for today's podcast. And we have an awesome guest with us this morning, Dr. Andrew Phillips out of Austin, Texas, interventional pain physician, capital pain. Man, we are so glad you're here in Kansas City. Thanks for coming on today.
Hey, thanks for having me. I'm excited to be here.
Yeah. Briefly, I had the chance to meet you this summer at Aspen in July in Miami.
Yep.
And this is totally off script, but it just came to my mind because we were talking about this upstairs in the kitchen. I think this story is so cool and how you kind of got connected to Spinal Simplicity.
Mm-hmm.
We were talking about your rep, Evan Illingworth, and another doctor. You're at Aspen. Can you briefly just describe how did you get connected to our company in that way?
Yes. So yeah, at Aspen, which is the conference that we have in Miami, basically I got to meet Evan, and I had known about primarily Minuteman I'd heard about, but I hadn't really been using it yet. And it was just something that I really never dove into. And he introduced me to someone there, Dr. Jarzenbeck. She's also in Austin. And he's like, you got to meet this girl. She is doing it and it's working well. And I was like, to be honest with you, not training on it previously in fellowship. And really, we didn't get much insight into it prior to meeting Evan. He introduced me to Dr. Jarzenbeck, and she basically explained to me how well it was working for her patients. So she was telling me specifically, and I can dive into a little bit further later, but about certain patient populations that when she was able to utilize Minuteman, that it was just working with amazing results. And it was that kind of like taking that, hearing it from a young colleague that also didn't necessarily train on it previously, and took that and started doing it on her own and having these great results. It just ultimately led me to putting a little bit of faith, research-driven faith, into trying Minuteman out for the right patient. And that's kind of how we got started. And ultimately, the outcomes have been spectacular.
Yeah, I love that. I love that you were able to connect with a colleague at a society meeting, and then you have your rep, Evan, there. Just a really cool starting point to being introduced to MIS therapy. So talk about that a little bit. So you start using Minuteman at your practice. Like how have the patients been doing?
Oh, so the patients, honestly, it's spectacular. The patients are doing amazing. Typically, we look at patients in a bunch of different ways, like when it comes to back pain. But the ones that tend to do absolute best, you see the back pain with the leg pain. And the reason I say that is because ultimately for these type of patients with what we call neurogenic claudication, we are seeing these leg pains resolve truly or significantly relieved in a couple of days. I mean, you're taking the pressure off these nerves, and it's just been really spectacular results.
Yeah, even right after the procedure, oftentimes when I'm in cases, you go and the patients, their back pain might still be there a little bit, but as you mentioned, the leg pain, typically that's bothering them so much from that foraminal stenosis, is almost gone, isn't it?
Yeah, it's amazing. It literally goes away within a couple of days. If for the right type of patient, and when I say the right type of patient, I'd say some of the I'd say slam dunk kind of people are, we are looking for some of these instabilities that are causing these stenoses, and then therefore causing these pinching of these nerves. And when you're using the Minuteman and it's taking the pressure off of it, we're just noticing the leg pain going away just in a couple of days. It's really spectacular.
Yeah, we know that's what Minuteman does, right?
Yeah,
It lifts it, balances, realigns it, and just helps patients with that foraminal stenosis. So that's awesome.
Yeah.
That's really good. So were you surprised yourself as you learned about Minuteman at Aspen, maybe a little bit before that, but really got introduced more in depth, that you adopted it so quickly in your practice and that patients were doing so well? Because I'm thinking about other physicians who are, maybe 5 years or less out of fellowship, and they're thinking about doing something like Minuteman. Did that surprise you at all, how quickly you jumped into it?
Kind of going back to what I said, it did surprise me a little bit, but ultimately what I was seeing with my patients is there was this void of these type of patients that, we had either injections, maybe spinal cord stimulators, and surgery. but there was nothing in between. There was nothing that I knew of in between. And all of a sudden, when I saw this thing that was there to treat this area of focus that I didn't necessarily have anything before, and sending these patients off to surgeons and getting these big fusions and having these long recoveries, and then ultimately when I was able to see that this truly easy procedure that has huge potential benefits and impact was with a minimal recovery. It was easy to adopt. And the second I started doing it, and then within a week or two following up with these patients, and they're like, no, after day 3, my leg pain was gone. There was no doubt in my mind that like this was an amazing device to basically be using. So, I mean, seeing it firsthand, I think the first part was the faith that you had to put in it, which we go back to when I talked to Jarzenbeck and having that whole interaction at Aspen, which was, I mean, that's kind of what you need. You kind of need some other doctor that has adopted it and is seeing these results and can explain to you their situation and how it's working. And then you kind of finding those type of patients, trying it yourself, explaining to the patients what they can expect and having those realistic expectations, and then seeing it firsthand. I mean, after that, it was, there's no going back. And ultimately, we have just continued to do more and more and more for the right patients. And I haven't stopped seeing the great results. Truly, it's almost guaranteed. And I can't say, you don't want to say that in medicine, and I would never necessarily say that to patients, but it really is. It really is.
Yeah, and we were talking about upstairs too before the podcast, how like you seeing the outcomes has really given you confidence to speak to other patients. Talk about that a little bit.
Yeah, I mean, well, you know, when you talk with patients, they always ask you, I mean, not always, but they always ask, how many of these have you done? What are the results you've seen? You know, tell them, what about other patients like me? And now that we've done enough of them, you know, I kind of knew early on, but now that we've done enough, I can say wholeheartedly, not only from some of the research that's been done, but anecdotally, what they can expect and what benefits they're going to get. And I believe in it so wholeheartedly that it's so easy to speak to. It really is. It really is.
And has it changed, now that you have a tool like this in your tool bag, has it changed the type of patients that are being referred to you?
Yes, it actually has. So what we do usually is, you know, we have all these relationships with other physicians or nurse practitioners or other practices. And, you know, they kind of know stuff that we're doing, but we do try to educate them on stuff new stuff that we are doing. And now, after I've gotten these results and these patients have actually returned back to their providers and shown them the results that they're getting, we are starting to get stuff specifically for this, for using Minuteman. And now, even from surgeons, I am actually getting referrals for this as well, because they see that this is a mechanical issue. There is something that we can do to fix it that, again, like I said before, is an easy recovery and a very minimally invasive procedure. So I'm actually getting direct referrals to evaluate for this now. It's great. So, you know, a lot of times we try to do the most conservative stuff, right? We do our physical therapy. We have certain medications. You know, other people have different comorbidities. They can't take certain medications. Physical therapy, some can't tolerate it. They've done several rounds and done nothing. So we try to go that route. But sometimes for some of these patients too, you know, we do an injection at the site that we know where the issue is, able to give them a peace of mind too, that, hey, you got some great relief from this spot. This steroid reduced inflammation around that area where you have some of that instability and stenosis. But ultimately, it's going to come back because it's still narrow there. It's still going to get affected. And this is that fix. So they understand the concept a lot better when they are able to see that too sometimes. So I kind of took a little turn on that there from the referral source, but it's just been great. And I just love them going back to their providers. And, you know, besides pain, the other things we look at is like mobility. So I ask a lot about, like, they're like, you know what, I'm walking. I'm like, are you though? And like, how far are you walking? And they'll be like, I go to the mailbox. That's it. And so when they come back, sometimes not only is the pain better, but it's amazing to hear. I had somebody come back the other day from just going to the mailbox to now walking like 2 miles. So within a short amount of time. So it's really amazing. I had one come in the other day. I mean, listen, I don't want them to go crazy, and every patient is different, but came in and she was like twirling and dancing. And it was just like, that was her goal, is to dance again. So it was a really amazing experience.
Oh, those are great stories. I bet that just gives you energy, doesn't it?
It does. I mean, you can tell. I could just keep going on and on about these. There was another great one where There was a couple where the wife was taking care of the husband. He couldn't really walk very well or whatever. We did a Minuteman, life-changing. And again, I know every story is different, but pain was better, walking more, doing chores around the house again, more so than the wife now. And so she came in, she's like, I don't like that he's doing better than me.
Oh my gosh.
I was supposed to be the one taking care of it. She's like, I have similar symptoms. Can you evaluate me? And of course, it may not have been the same thing, but she did have the same kind of, pain in the back and the legs, worse when standing, worse when walking, better when sitting or with flexion, and with that corroborated with the MRI studies as well. And we ended up doing a Minuteman for her too, and they're both doing spectacular. So it's just a really cool experience.
What a story.
Yeah.
That is really cool.
Yeah.
I think that's the first husband and wife. There might have been one other one,
Yeah.
but
it's great.
that is a really cool.
It's really cool.
I love that.
Yeah.
Okay, real quick,
Yes,
rapid fire break. We're
yes.
going to have some fun questions
Okay.
here in the middle. So, all right, number one, coffee or energy drink on procedure day?
Coffee.
Okay, what's your go-to coffee?
Black coffee, cold brew, light ice, nothing else.
That's it.
That's it.
Yeah. You have a certain coffee shop you go to?
My wife would hate me for saying Starbucks because it's just easy, but
Yeah.
but there's so many better. Actually, wipe that out. Don't tell anyone about that.
That's awesome. So, okay, good. So coffee, just
Okay.
black.
Black coffee.
Love it. All right. Kansas City barbecue. You're going to have tonight, right? I think. So maybe you can't judge this yet.
I could judge it.
But
I
okay,
can
so
judge it.
this might be a question later. But Texas barbecue, Kansas City barbecue. Now you did you were at Lake of the Ozarks in the summer, so
Yeah,
maybe you had a hint of that.
I did. I grew up going to Lake of the Ozarks every summer for a month.
Yeah.
So we did. We always got barbecue here. Listen, I love meat. So they're both winners, but Texas barbecue all the way.
Oh, come on.
The brisket, man.
We're not going to persuade you while you're here, are
You
we?
can't. I mean, literally cannot persuade me.
Do you have a go-to restaurant in Texas for barbecue, or do you kind of spread it out?
I spread it out. I don't go to the usual ones you probably know of, like Franklin's
Yeah.
and stuff. There's actually a really good one called Micklethwaite. Say that 5 times.
Micklethwaite?
Fast. Micklethwaite.
Micklethwaite.
Yeah, we love
Okay.
it. It's fantastic.
Is Mission Barbecue in Austin? That's Nashville.
Yeah,
That's
yeah,
Nashville.
Yeah,
Okay.
don't even bring them into
Yeah,
the mix.
no, that's not even going to be in the conversation. Not even in the conversation. Okay, you mentioned earlier that you are expecting your
Yes.
first baby boy. Congratulations,
Thank
by the
you.
way.
Thank you.
What are you most excited about and afraid of?
Oh man, they might be the same thing.
Yeah.
I'm just so excited to see. I mean, just this little guy that is like a mixture of me and my wife to come out and I am. And we just got a puppy too, so maybe he can ride the puppy. I don't know, but I'm just excited to see what this new chapter brings. But I am also scared of that exact same thing.
Yeah. I
But
hear you.
yeah,
As a parent myself, I can totally resonate with that. What kind of dog do you have?
we got a Bernedoodle.
Okay.
It's a mixture between a Bernese Mountain Dog and a Poodle. So it's going to be huge, but it doesn't shed.
Yeah.
So it's good stuff.
That's awesome.
Yeah.
Okay, let's talk about the relationship. Thank you for that, by the way.
Yeah,
I
yeah.
love getting to know our guests just a little bit more personally.
Absolutely.
So that's awesome. Let's talk a little bit about your relationship with your reps in the room. So you met Evan and Scott Sherman, and they are a vital part, I think, of the partnership with how you identify patients, how you treat patients, and just talk a little bit about that, like your relationship with
Yeah.
them.
I mean, kind of going back to what I said before, when I met Evan and Scott, one of the things beyond talking like Jarzenbeck and things like that, their enthusiasm has rubbed off on me as well. They were so enthusiastic about it. At first I was like, what's going on here? But ultimately it's because of their belief in what they're doing. And so we got to know each other and, we went through all the training together and through our first cases together, and the support that they have provided has just been it's just been spectacular. So I never feel like I'm alone with anything. So, when you're first starting off with any new thing, I mean, I rely on them. I rely on them wholeheartedly for anything that just is related to the simple stuff that comes so simply now. But even beyond that, helping get the word out that, that I'm doing these types of procedures, explaining things. I remember I said before, even these other providers that are now sending to me, they didn't really even know about this or existed. So they helped me kind of also get some better understanding out in the community as well about what it is that we're doing. And then, even like post-procedure, like they're calling the patients like 2 or 3 days later, checking on them, we're having, they just are there for every step of the way. And it's just been extremely helpful. It's been extremely helpful.
That's
I
amazing.
actually couldn't imagine doing it without them.
Oh,
So,
I love that.
Yeah, they're awesome.
That's so great. You talked a little bit about training and coming in and having other faculty members that are with Spinal Simplicity train you on Minuteman and Liberty as well.
Yeah.
I know sometimes there can be a perceived gap in the market a little bit in fellowship, and then you come out and then there's new technologies that maybe weren't there when you were in fellowship. So talk about the learnings there for you as you got trained, how that made you more comfortable, and then ultimately led you to start using the product.
Yeah, I mean, when you're in fellowship, depending on where you go to, like you train on what's available at the time and what's kind of going on in wherever you are in the community. So we did, I think I did a little bit of mild and some of that stuff, but when I came out, you're starting off on your own and you're just want to get the bread and butter stuff down. You don't take too many, you don't get too involved in some of the other stuff that's out there. But going back to the enthusiasm and support from Evan and Scott and just the reps from Spinal Simplicity, they just make you feel so comfortable with this new thing, like holding my hand. I mean, I'm sterile, but metaphorically holding my hand, like when I'm in the room. But I basically goes back to what I said before in the sense that once we got the first couple under our belt and saw the results that quickly from them that were so good, we were all just excited to keep going forward, honestly. And then in my practice, even we have some other docs that now seeing me do it, and they have patients that remember what I said earlier is that we got injections, we got medicines, physical therapies, spinal cord stimulators, like surgical stuff, and they're saying, oh, I have a lot of these patients that we've just been kind of managing, medications or whatever. Let's see if these people are interested in this, and they're now starting to do it too and seeing the same great results. And it's kind of spreading like wildfire.
Yeah, I love that. Obviously, we know that there are some patients that do need further surgery, but for those candidates, that's awesome that you're able to offer them.
No, I wouldn't take away that there's need for all aspects of this stuff. Then this isn't necessarily for everyone, but I think for the appropriate candidates, and that's the point to make. It's a really good product to use.
Yeah, which we talked about earlier, right? The foraminal stenosis and leg pain. How do you talk to your patients about Minuteman when they're in the clinic and you've done an epidural? It sounds like you're educating them early on, right? Hey, if this doesn't work, we have something else for you. How do you talk to them?
So usually, pretty early on. I mean, a lot of times not always, but they've tried some different things, right? So we have a lot of information to go on, stuff for diagnostic criteria as well. And so whether it's a lot of times it's maybe we do like an injection like we were talking about, and hey, I hope that this does the trick, right? I really do, but we're looking for a couple months out of this. And if you're getting a week's worth of pain relief, we've proven it. We know where it's coming from. Again, you fit this criteria, and I bring up pretty early on, like, hey, this could be a good short-term fix to help you with some of the severe pain right now. And if it lasts longer, great. But if it doesn't, we do have this other thing that we do like this. And, I can explain kind of how I talk to the patients about it as well. But I kind of bring up the short-term and long-term options pretty early on as well.
Yeah, that's great.
Yeah.
How do you talk to them about it?
Oh, so probably the way I bring it up to them is that I usually have a spine model, and just like this. Oh, this one, someone placed this very well. So I kind of show them this, and I kind of a lot of times also explain to them too, like whether they have listhesis or whatever. So a lot of times that stenosis is sometimes a hard topic to grasp for them sometimes, because so I have stenosis, like how's that my disc or what? So anyways, I usually show them, listen, you got these joints here, you got some arthritis, it causes this overgrowth, you hear about bone spurs, et cetera, that kind of stuff. And it can lead to maybe some narrowing of the hole from this direction. Then you got a little disc bulge here, and it's narrowing the hole from this direction. And then you got your discs are less plump, so you're narrowing the hole this direction. Your ligaments are thicker potentially in here. You're narrowing some more space in that direction. And ultimately causing this that is what causes this stenosis. And I show them on here. And then what I tell them too is like, and this is like, see, when you stand up, it smushes it more. When you sit, it opens up the holes. Our goal is we want to try to make that hole open for longer so that this nerve stops getting pinched and the muscles can get the nerve, signals, the proper ones, and stop getting some of this pain. And ultimate goal is just moving more, which is a treatment in itself. And then I kind of tell them, listen, I hold it here and we go from the side. That's one of the cool things about this to begin with, right? We're not aiming at any important structures in the spine. We're coming from the side. We're behind all the important stuff. Nerves are in the front, spinal cord's in front, organs are in front. We're in the muscle only. And we kind of use these almost like larger needles, and that's how we kind of get Minuteman in there, but they have this like dull tip at the end, and it's trying to kind of more push some of the muscle away rather than causing a lot of tissue damage, and to get to this spot, again, outside the spine, and ultimately try to open this up. And I'm like, from start to finish, it's a pretty safe, quick, easy procedure that has a lot of good potential benefit as well.
Yeah. Well said.
Yeah.
Going from narrow to opening, basically. And I love that you bring in the anatomy too, and that you show the patient the anatomy. Do you feel like patients are interested in that nowadays? It seems like they're doing a lot of education ahead of time, doesn't it?
It does. Yeah. It does. Sometimes they even come in asking about different devices or things, injections, or even just things that they see on their MRI, which is good. You want them to understand it because it's the medical terminology is a lot of fancy words for some simple stuff sometimes, right? So just showing them on that, honestly, I think that's pretty much a big game changer. When they can visualize the spine and see that, hey, when I do an epidural, I'm going inside the spine. That's going near the important structures. Obviously it's safe. We're doing everything under fluoro. But this is, yes, it seems like a step above, which it is, but it's all outside the spine, away from any important structures, but ultimately helping those structures at the same time. So it's just kind of, when you visualize it like that, it just makes such a big difference. And back to what you said before, I usually will show them that on the first appointment, if that's what I think is really causing the pain, and then go into what we were talking about here's some options. I hope this lasts, but this could be more of a short term for severe pain. And then we have this thing for more long-term relief and trying to fix the problem long-term.
That's so great.
Yeah. It's really nice.
We've talked about obviously Minuteman and the excitement that you have because of the way that patients, their outcome, ultimately that's what it's about, right? The outcomes of the patient. So, and then you've started to think about, and I've done a few of the Liberty implants now. So maybe talk about your thinking of when you saw it first, Liberty, lateral approach for SI joint fusion, and how your patients have been doing in these past few months.
Absolutely. So, yeah, I mean, a lot of the stuff we trained with was more posterior. So it was definitely thinking about it a different way from lateral. But it kind of makes sense. It's going from that approach, to me, feels like you'd get some of the best stability when you're trying to fuse that SI joint. But again, going, just like Minuteman, it became one of these things where I like the idea behind it. There's good data behind it. There's good safety and efficacy behind it. And I just wanted an appropriate patient that was open to doing this as well and see the outcomes of it. And so the same kind of thing, we did one. I was like, okay, let's see how this goes. Called them in 3 days. Cannot explain. We get great relief, but she said it was 100% pain relief. So these are, and I'm not making these things up. These are what they're telling me. So I do tell them you're gonna have these muscle soreness and things like that. But from the pain that she came in with, it was gone within a couple of days. I mean, if you think about these joints, they become almost like these. I describe it to them almost as these like wobbly joints. They've been off for so long, and you've been using them improperly, compensating your biomechanics have been off for so long that they're not supposed to move very much, and they start moving. So not only do you get the joint pain, but you get the muscle pain over it from kind of almost overusing those muscles to try to stabilize that joint. So when you fix the problem, it gets better. And and a lot of the docs who do these type of things, they know there's a lot to get there. You have to do like 3 injections, different types of imaging, rule out hip pathology, rule out back pathology. By the time you get there, it should be good. But then I think this, compared to some other things that I've used sometimes, I mean, this lateral approach, I really like, and it's easy to visualize the landmarks and anatomy and basically where we place the device.
Mm-hmm. Oh, I love that your patients are doing so well.
They really are. They really are. They really are.
That's great. Okay, so talk to the physician who's listening today that is either nervous, wasn't trained on any MIS therapy, what would you say to them now that you've had experience in this and you've seen your patients do well, to give them confidence to maybe go to a training?
Yeah. I think if they look into their practice and they think about these neurogenic claudication patients, right? What we described, the ones that are back and leg pain, worse standing and walking, better with sitting and flexion, right? Just start there. So I'd say keep it simple. There are other utilities that you obviously are using it, like we talked about, that primarily this instability leading to that. But just keep it simple and look at that. Look for these listhesis. When you see that, and maybe these significant foraminal stenoses that come with it, not only will you make yourself feel better and the patient potentially feel better, maybe with an injection or something like that, to give yourself confidence that they get relief from that spot, but then taking into account that this procedure is such a safe, easy procedure to do, because you're not near any important structures. And you do have to kind of take a little bit of a leap of faith. Again, research-driven faith, but take a little bit of a leap of faith to say, what am I doing with all these patients? They're just we're just managing them with opioids or other medications, or they're just living in pain. And you don't realize that there's something else that you can do. So there is, and it just takes starting with one, seeing the results for yourself, and then you will understand what I'm talking about.
I love that. How many cases did it take for you to say, okay, now I'm feeling pretty good about this?
I'd say probably 3 or 4 cases, because when they were all coming back with the exact same results, then it's like, okay, there's something going on here. There's something great and something to this. So, and then around that time too, you feel really confident about what you're doing. Any new procedure, you want to take it slow and step by step. And I still do, and very meticulous, but you feel confident about the procedure and you feel very confident about the outcomes. And then once you see it, speaking to it, as you can tell, I'm very excited about it. It's easy to discuss with patients because you have seen the results. It's really remarkable.
It's such a good approach. It's refreshing to hear from you that you started with 3 or 4 cases, but you wanted to see like how the patients are doing.
Absolutely.
Before you took that next step of, okay, I'm going to start looking for these patients in my practice more often.
Yep. Yes.
And I love that approach.
Yes. And it worked well. And once we did feel that, we found a lot of patients quickly, because for like what I was saying, we were just kind of managing and we weren't really getting anywhere beyond that yet. So.
And I imagine a lot of these patients were either not surgical candidates, they weren't getting long-term relief.
Yep.
And so we talk about it here, like there's this benign neglect of these patients that just don't get anything. And so they're just in pain.
Yes.
And so I love that you were able to find some more patients.
No, absolutely. And they're out there too. Once you start looking for them, and again, you see the confidence and get confidence in yourself and in Minuteman, then it just becomes pretty natural.
Yeah. Okay, so I know for our audience, those who are not watching on YouTube or whatever it is, you can't see what's happening here, but Evan and Scott are actually in the room with us, and they're watching this. And so I'm saying that because I want the audience to hear this. If you were to give our Spinal Simplicity sales reps advice on how they can help their physicians like Evan and Scott have, like what would you tell them?
I mean, what helped the most for me was getting me in touch with it doesn't have to be young, but with an excited physician who is seeing these results that I'm seeing now. And so for me, that, like I've discussed with other people in my practice, when I talk to them about it, they also want to see, hey, is there something to this? That was the thing that leaped me the quickest and the furthest, I think, when I got to hear it firsthand.
Yeah, just using their connections within the market.
Really.
Yeah.
And it's cool. I mean, those conferences we go to, I mean, yes, there's a lot going on there, but it's a great place to meet people who are doing this kind of stuff and to connect us together. And honestly, if he hadn't done that, I don't know if I would be sitting here with you right now.
That's where you and I met.
Yeah, that's
right?
where that
Evan
is.
texted me in Miami. He's like, hey, you got to meet Dr. Phillips.
Yes. I mean, I'm biased. I think I'm amazing, but
we do too.
Yes, but thank you. No. But yes, modest as well.
Yeah, no, I just love that story. That's so good.
It is. It's really great.
Where do you see, and this is the last question for you, where do you see either your practice or maybe the space in general, interventional pain, like evolving in the next 3 to 5 years? Like we have some MIS therapies now, obviously like Minuteman and Liberty and Patriot, and other companies obviously have great technology as well. Where is it headed, do you think? Like what's next?
I don't know.
More of the same?
Probably more of the same, but maybe in just maybe change in some of the technology and maybe make it a little bit more small, or just like how this one now, you guys have ways of trying to push more muscle aside rather than kind of cutting through, just different ways to make it, it already is a very minimally invasive procedure, but to continue making it even more and more, what's the word?
Just less invasive, right?
Less invasive.
Yeah.
There it is. But basically that. I wanted to answer with AI, but I don't know what that means.
Hey, I like that. Right? Are you seeing that at all? Like,
it's happening, but I haven't seen it much into the. Actually, that's not true. My wife she's a gastroenterologist, and they have AI when they're scoping. They don't use it all necessarily for everything, but it points out things that maybe could be something. So it actually is starting to get integrated. Wow. So I haven't seen as much into our field yet, but I could see. I mean, something will probably come out.
There are some companies that are doing like physician avatars, so you can like record yourself, and we could look into this for you if you want to. But it's kind of cool.
That is cool.
Like you record yourself, and then any script you want to write, it takes your avatar and it creates a video for you.
Oh my God!
Yeah. So you can like record a video talking about a new therapy that you're offering, put it on a little video to give to your patient.
Oh, that's great.
Isn't that cool?
That's really cool.
I know. So it's coming quick.
Can I wear a small shirt on my avatar?
You can wear whatever you want.
Sorry, you're not here, but yeah. I like the small shirt.
I love it. I love it. What's your go-to, like, where do you work out? Where do you exercise?
There's actually a gym by my office. It's like, it's called HIT. It's a HIT class place, but I don't do the classes. And there's like a tiny, like kind of just everything you need in a gym, like kind of small in the back, but no one uses it. So just go in there.
It's perfect.
It's perfect. It's perfect.
Do you do CrossFit?
No,
I've never done that. That's crazy.
Don't do it. If you do it out there, feel free, but I'll see you as a patient.
Right. That's awesome. Well, Dr. Phillips, thank you so much for being our guest on the MedTech Insider. We really appreciate your time. Thank you for joining us today. We will see you next time.
Thank you. Bye-bye.